Robby, what's on your radar?
One of the silver linings of the pandemic, the only silver lining, has been that young people are less affected by COVID-19 than the elderly. In fact, the most vital indicator of negative coronavirus outcomes is age. Unlike the Spanish flu, which ravaged armies that were overwhelmingly comprised of otherwise healthy young people during World War I, COVID-19's death toll is dramatically skewed toward those who have already lived many years. That said, about 600 Americans under the age of 18 have died of COVID-19 during the pandemic. Now, a new study from the Centers for Disease Control and Prevention took a closer look at young people who were hospitalized for the coronavirus in July and August of this year, while the Delta wave took hold. And they largely found that healthy young people continue to mostly evade the worst of COVID-19. The study found that most young people who suffer severe COVID-19 outcomes had underlying health conditions. The most common, especially for teenagers, was obesity. Among patients aged between 12 and 17 years, 61% had obesity, according to this study, 60.5% of whom had severe obesity. So the study looked at 6 U.S. hospitals, all of them in the American South, where obesity rates are higher, so it's important to keep that in mind, and evaluated 915 cases of COVID-19 in adolescents that did require hospitalization. The vast majority were hospitalized for COVID-19, though some had other infections as well. But for most of them, COVID was the primary reason. For 713 of the patients, COVID was the primary reason they were in the hospital. 2/3 had at least one underlying health condition. For the teenage cohort, that's patients at least 12 years of age, the obesity rate was 61%. The severe obesity rate was 60%. Just one of the eligible patients had been vaccinated, and 11 patients died in total. What this means, of course, is that COVID-19 can be a fatal disease, even for young people. But vaccine status and general health are extremely important variables. It remains the case that healthy children who do not have underlying health conditions, particularly obesity, are by and large safe from negative COVID-19 health outcomes. Compared with patients without obesity, those with obesity required higher levels and longer durations of care, wrote the study's authors. These findings are consistent with previous reports and highlight the importance of obesity and other medical conditions as risk factors for severe COVID-19 in children and adolescents. One of the best ways to guard against obesity is to encourage healthy eating and active lifestyles among the youth population. Exercise is not a panacea, but kids who play sports or engage in physical activity are less likely to become obese. Physically active kids have better diets than those who stay indoors all day glued to their screens. It's important to perform this reality check. The more healthy and active kids are, the less COVID-19 threatens them, given just how much the lives of young people were upended by coronavirus mitigation efforts. In the name of slowing COVID-19 spread, public health authorities closed schools, shuttered extracurricular activities, and instructed young people to remain by themselves indoors. Even benign activities like playing at the park were discouraged for the first few months of the pandemic. You remember those photos of gated parks, shut down with chains so kids couldn't use them? Now, while many activities have resumed, some college campuses, for instance, would rather their student populations quit sports than dare to do it unmasked. This is important, and let's not overlook it. In the name of preventing COVID, pretty much everybody in a position of authority in the public health world said to close down schools for months. When public health officials said schools could reopen, teachers' unions fought it. They're still fighting it. Last week, I lamented that the Chicago Teachers Union is prepared to go on strike to prevent in-person learning. Now, they can do whatever they want, of course. The teachers have tremendous power, but they can't claim they have science on their side. They can't claim they are representing the best interests of children. We know they are not. Children need to go to school. They need to be stimulated. They need to get balanced meals. They need to participate in physical activity. That's what protects them from severe COVID. Now, those who have rule-making power over young people would be well advised to consider whether the purported cure is worse than the disease, or whether it makes the disease more serious. Young people need socialization and activity. They need a reason to put down their smartphones and venture out into the world. It is not in the interest of public health to keep them shut up in their bedrooms or dormitories for long periods of time. As the super infectious, though seemingly more mild, Omicron variant threatens to force public health officials to re-implement stringent mitigation measures, let's please, for once, think of the children. So I thought this was a really interesting study. This was looking at 6 hospitals in the South, and found, so it was not the case that, some people said, oh, the kids being admitted to the hospital, it's something else, they just incidentally have COVID.
Right.
No, most of them were admitted for COVID. But you had the number one thing you would note from looking at the study was obesity, severe obesity being the huge factor at play for them being in the hospital. The kids who were not severely obese had a much easier time of it, and most of them were severely obese. So that suggests a public health strategy, and you can't magically cure childhood obesity with exercise and better dieting, but it's an important start.
Right. And 1 in 5 kids are obese. So that is on the one hand, for kids who are not obese and parents of kids who are not obese, they might breathe a sigh of relief. But 20% of the child population is obese, which puts them in this higher risk category. It's less, of course, for severe obesity. The other thing that struck me, and you've looked at this study closer, but talk a little bit about the vaccinated versus unvaccinated outcomes in hospitals. It seemed like a pretty stark point in favor of vaccinations.
It did, yeah. Absolutely, the takeaway would be vaccination would have been advisable. So I'm not sure how many people were actually eligible for vaccination yet, because this was looking at July and August, but there was one vaccinated person in the pool. But so the overwhelming, like 99% of them were not vaccinated. Now I'm not sure how many of them could have been vaccinated, but it would make the case.
12 and up could be, but not under 12.
Right, but it would make the case. I mean, you do have, like, this was a good number of young people who were in the hospital and had a rough time of it because they were obese. If you're obviously, it should be your choice, and you should make this choice in consultation with your doctor. But if you have an obese child, consider that they are at some risk of ending up in the hospital because of COVID, and you might. We're being very careful. You consider everything, but you might the vaccine calculus might be a little bit more in that case because of how severe obesity can affect you if you get COVID.
Right, and that's in the rubric of where taking the vaccine is you're not thinking about the community transmission or anything else. You're just
just for you.
Just thinking about from your own perspective. Right. A lot of people say, well, children. The side effects of the vaccine, we don't know the long-term side effects. They don't mention we don't know the long-term effects of COVID either. Right. For some reason, that doesn't get.
But it is true. About. Most children are not going to have a bad time with COVID. It is not a serious disease for most of them. But look at this study. This was a good number of hospitalized children, and obesity was the big factor. So if your kid has an unhealthy lifestyle, but again, now it's important to get kids better lifestyle. Right. They should be outdoors. They should be active. They should be playing. And what we've done to prevent that is just horrible.
Right. And they don't have a chance. They don't have a chance to do that if they don't make it through this pandemic. Right. Too. But like you said, there were very, very few deaths, even. Yeah. Like what, 1 or 2?
No, it was 11. 11 of the 9. So 900 hospitalized kids, and there were 11 deaths.
And any of those vaccinated that we know of?
No. So again, it was just. I think it was just one person in the whole thing, and it was the one person was not among the deaths.
Right.
Yeah.
Right.
Yeah, so it was an interesting study from the CDC, again, looking at so where the obesity rate is higher in the South, so that's going to skew the results a little bit. You have more of your total pool is more obese than in a different part of the country, so obesity will show up more in but still, that was some pretty high number. I mean, from the 12 to 17 age, there's 60% of the people severe obesity. These are in this age group for teens. So,
it's a huge risk factor.
Yeah. Watch what you're, get them, this is basic stuff, right? Get them vegetables, make sure they need gym class, they need things like that. And it's harder to do, like some high school, running team, they have to wear masks to do, how do you even do that? It's crazy. It's crazy. Yeah. It's not healthy. It's not helping them. So.
Yeah. But yes, if you're 13 years old, obese, or severely obese, you're at serious risk.
Yeah, I would strongly consider vaccination in that case. Absolutely. Yeah.
Anyway, Team Rising joins us next.